Good evening, everyone. I'm Dr. Aditya Sharma, Senior Resident in Department of Ophthalmology, Lady Hardinge Medical College, and I'll be talking about the novel variant in a consanguineous family with ataxia telangiectasia and esotropia. Ataxia telangiectasia is a rare multisystem complex neurodegenerative disorder of autosomal recessive inheritance characterized by cutaneous and neurological manifestation with progressive ataxia and mutation on ATM gene on chromosome 11q22-23. In the following case, I'll be discussing about the various manifestations of the disorder, and the purpose is to study the whole exome sequencing to identify the novel variants in a consanguineous presumptive autosomal recessive family with all three offsprings having ataxia telangiectasia and esotropia. The study is a hospital-based whole exome sequencing analysis of a rare syndrome and whole exome sequencing of phenotypically affected three offsprings, aged 12 years, 16 years, 12 years, and 5 years, with AT and ET, demonstrating different stages of neurodegeneration and ataxia were performed. The children presented with bilateral eye redness, nystagmus, and esotropia. Redness was persistent, no other associated ocular symptoms. All the three children were developmentally normal initially, and they were immunized appropriately for age. Birth history was unremarkable. The children were born of consanguineous marriage, and they had history of repeated episodes of cough, coryza, and pneumonia, but no systemic complaints on presentation. The two older children, that is one male and one female, were healthy at birth, but later on were not able to walk without support and thus dropped out of school. The children were stable and well-oriented. Systemic examination was within normal limits in the younger child, but the older children showed features of neuroregression, difficulty in speech, and ataxia. Head position was normal, nystagmus was present. Neurological examination was unremarkable in the younger child. However, ataxia and gait abnormalities were there in the older children. Visual acuity was fixing and falling. Conjunctiva showed bilateral dilated and tortuous vessels, as we can see in the images. Sclera, cornea, anterior chamber were within normal limits, and so was fundus examination. MRI brain was performed and was found to be within normal limits. Whole exome sequencing was done in all the three children, and it identified a homozygous likely pathogenic variant in the ATM gene on chromosome 11q22-23, exon 48. Thus, a diagnosis of ataxia telangiectasia was confirmed. The children were prescribed topical decongestant medications, appropriate refractive correction was done, and they were advised exercises for rehabilitation, gait training, and activities to improve trunk balance. Parents were counseled about the type of inheritance and thus asked to get genetic counseling before planning another child. The incidence of ataxia telangiectasia is more in children born of consanguineous marriages, and usually ataxia is the first noticeable sign in such condition, but in our case telangiectasia was seen first. It is seen mostly on conjunctiva, facial skin, and almost found universally. However, it is more common on sun-exposed areas like ears and face. With progression, dysarthria, oculomotor apraxia also manifest, and this affects vision, reading skills that can impact children during their first years of school. Immunological impairment is also common in around 66% of the cases with low IgA, IgG levels and low CD4 count. Although these children are predisposed to pulmonary infections and tumors of lymphoid origin, fastidious surveillance of breast and ovarian cancer can be life-saving. Cerebellar atrophy is noticeable in adult patients but may be absent in pediatric age group as seen in our case. Antioxidants, antisense, morpholino, oligonucleotide, aminoglycoside antibiotics that can affect ATM protein are currently being tested for future purposes. Thus, I would like to conclude that the familial concomitant esotropia is a relatively uncommon phenotype associated with familial ataxia telangiectasia, making this a rare case presentation. The homozygous novel variant on the AT gene confirms the autosomal recessive inheritance and supports the genetic counseling to stop further transmission of the condition. Early diagnosis and supportive care are pivotal, and genetic testing is essential for confirmation and family counseling.